treatment for schizophrenia involves the use of antipsychotic drugs. The term antipsychotic refers to psychosis. A person with psychosis experiences some loss of contact with reality, for example, through hallucinations or delusions. Psychosis is a defining characteristic of schizophrenia and related disorders. Antipsychotics may be required in the short or long term. Some people can take a short course of antipsychotics, then stop their use without the return of symptoms. Other people may require antipsychotics for life or else face the likelihood of a recurrence of schizophrenia. Antipsychotics can be divided into typical, traditional, and newer atypical or second-generation drugs. Typical antipsychotics. Typical antipsychotics have been around since the 1950s and include chlorpromazine, which can be taken as tablets, syrup, or by injection. If taken orally, it is administered daily up to a maximum of 1,000 milligrams, although initially doses are much smaller, and for most people the dosage is gradually increased to a maximum of 400 to 800 milligrams. Typical prescribed doses have declined over the last 50 years. Liu and Dehan, 2009. Dopamine antagonists. There is a strong association between the use of typical antipsychotics like chlorpromazine and the dopamine hypothesis. Typical antipsychotics like chlorpromazine work by acting as antagonists in the dopamine system. Antagonists are chemicals which reduce the action of a neurotransmitter. Dopamine antagonists work by blocking dopamine receptors in the synapses of the brain, reducing the action of dopamine. Initially, when an individual begins taking chlorpromazine, dopamine levels build up, but then its production is reduced. According to the dopamine hypothesis of schizophrenia, this dopamine antagonist effect normalizes neurotransmission in key areas of the brain, reducing symptoms like hallucinations. Sedation effect, as well as having antipsychotic properties. Chlorpromazine is also an effective sedative. Is believed to be related to its effect on histamine receptors, but it is not fully understood how this leads to sedation. Chlorpromazine is often used to calm individuals not only with schizophrenia, but also with other conditions. This has often been done when patients are first admitted to hospitals and are very anxious. Syrup is absorbed faster than tablets, so it tends to be given when chlorpromazine is used for its sedative properties. Atypical antipsychotics. Atypical antipsychotics have been used since the 1970s. The aim in developing newer antipsychotics was to maintain or improve upon the effectiveness of drugs in suppressing the symptoms of psychosis and also minimize the side effects of the drugs used. There are a range of atypical antipsychotics, and they do not all work in the same way. In fact, we do not know how some of them work. Clozapine was developed in the 1960s and first trialed in the early 1970s. It was withdrawn for a while in the 1970s following the deaths of some patients from a blood condition called agranulocytosis. However, in the 1980s, when it was discovered to be more effective than typical antipsychotics, clozapine was remarketed as a treatment for schizophrenia to be used when other treatments failed. It is still used in this way today, and people taking it have regular blood tests to ensure they are not developing agranulocytosis. Because of its potentially fatal side effects, clozapine is not available as an injection. Daily dosage is a little lower than for chlorpromazine, typically 300 to 450 mg a day. Clozapine binds to dopamine receptors in the same way that chlorpromazine does, but in addition it acts on serotonin and glutamate receptors. It is believed that this action helps improve mood and reduce depression and anxiety in patients, and that it may improve cognitive functioning. The mood-enhancing effects of clozapine mean that it is sometimes prescribed when an individual is considered at high risk of suicide. This is important as 30 to 50% of people with schizophrenia attempt suicide at some point. Risperidone is a more recently developed atypical antipsychotic, having been around since the 1990s. It was developed in an attempt to produce a drug as effective as clozapine, but without its serious side effects. Like chlorpromazine, risperidone can be taken in the form of tablets, syrup, or an injection that lasts for around 2 weeks. In common with other antipsychotics, a small dose is initially given, and this is built up to a typical daily dose of 4-8 mg and a maximum of 12 mgs. Like clozapine, risperidone is believed to bind to dopamine and serotonin receptors. Risperidone binds more strongly to dopamine receptors than clozapine and is therefore effective in much smaller doses than most antipsychotics. There is some evidence to suggest that this leads to fewer side effects than other antipsychotics.